this meeting. I think Emmanuel have been on my case for 4 months now, 4 or 5 months. But it's okay. It's good that at least we got time to do this. So I think Emmanuel said almost everything, really. I don't have anything to add. He wanted Emmanuel, we got to know each other last year when I was following up his wife, Diana, and delivering Tala. It's Tala, right? Yes. So yes, so and then eventually we kept on being in touch. When we discovered that we all like chess, love chess, he thought he could beat me, but obviously things went wrong as he was not intending to. So it's a pleasure to finally be here, where I have a small presentation to go along with my talk. So when he asked me to talk, I was actually, I've never done this, so I didn't have any specific subjects, but he proposed just, talk about anything about my field, and I didn't want to be too technical, which is why I somehow adopted a social angle of what I do, somehow, if I can say it this way. So, which is why we eventually came up with a title on how men might not realize how women experience life, like how they go through life, what they go through. So we might not really understand it because it's too different from what we know or how we go through life. And because I tend to deal with women on a daily basis, I might maybe bring some insights. I'm not saying it's all true or all absolute, but at least it's can be a basis or foundation for more discussions and eventually, interesting things to talk about. So I have a small presentation. I think it's around 9 slides. Let me see if I can share.
I think you can share your screen.
Yes. Okay. Let's wait a bit. Okay. Can you see?
Oh, it's now up.
Okay, I can't see it on my end. Let me try.
On our screen, on your Zoom screen.
Okay, let me.
Maybe you can put it in share mode, in full screen mode.
I'm actually trying to.
It's at the bottom. Right. Those 3 icons. Or you can send to me. I can do.
So you can see now. Huh?
Yeah.
Okay, let me just. Good. So yes. So I just made a few slides just to go along with my talk. Otherwise, I might not really go through every detail, but it's to help you at least to follow along. So good. So by how we can, I've noticed in the people who are on the call, it's really mixed, Kabisa. There are many men, many women. This is very good. At least we might have some insight from women, from the people who actually go through this. So good. So I'm going to go through some of as I said, the talk was women's experience of life and the male perspective, or how we view it, or how we are really, I would even say how men are really ignorant, because it's completely different from what we know, what we go through as men through life. So sometimes we might think, women are just other men, but with small changes here and there. But it's really very, very deep and different from what we might think. Good. So, Emmanuel, you can see the slides and everything?
We can see the slides, we can see you, we can hear you.
Very good. So, thanks. So the first slide is essentially what we're going to cover. Briefly, obviously, as I said, I'm not going to be too technical because there's no point of being technical. It's just more of a social aspect of of how we might see it, and maybe a basis for a discussion later, or in question and answer, even discussion. I would like really to be more of a discussion, because I'm not going to. It's not absolute, as I said. It's my opinion from the years, or perspective from the years of practicing. Eventually, we have women here. I also suspect the women who deliver, the women through things, so it will be more of a discussion. So it's mainly now going to talk about women, as I said. So first of all, there are many stages, obviously, but the big categories or stages we can eventually say is first the infancy or childhood, which generally speaking, I would say they share the same thing with boys, young girls with boys. Why? Because up to that point, usually, which is from birth to around 10, 11 years, there is really no difference, because the the hormones have not yet been activated yet. So you would find they might have, of course, some different perspective on how they play. For example, you would find boys tend to play aggressive games or competitive games. Generally, obviously, we always find exceptions, but generally. And we find women, or not women, young ladies or small or little girl would tend now to play more of, games of association, being together, not like boys who would hit each other, or, be too competitive, etc., etc. You can find those small differences, but the big difference now starts at adolescence now. When the actual hormones from both boys and men start to kick in. And now life becomes completely different from those two categories of people, mainly because of the hormones. And we'll go through it. And then second, with puberty and menstruation for women and everything that comes with it, the emotional change. It's not only menstruation, it comes with a whole background of changes. Then eventually, when they keep growing, when they become young women, I mean, with reproductive years, with being sexually active, with pregnancy, all that. So it affects also how they go through it. Eventually, once we go along, now comes menopause, perimenopause, and even beyond that. We're going to go through each of the stages, specifically from adolescence and menarche, which is more interesting. So something to add here, I've noticed people don't know this, and I would understand, because again, it's too technical, but it's an interesting fact to mention at this point. And I don't know if you know, but women are born when they are little girls. Women are born with all the eggs they will ever need throughout their life. which means once a girl is born, a female newborn is born, the body does not produce any more egg. Whatever amount of egg she has, that will be it for the rest of her life. So as she goes through puberty to menstrual cycle every month, that amount of eggs gets depleted until it goes down to zero. And then now that's what we call menopause. When she's not ovulating anymore, when she's not releasing an egg anymore, that's what we call menopause. So the reserve, we call it ovarian reserve or the amount of eggs, whatever you want to define it, which is completely different from men, from boys. When boys are born, our testicles keep producing sperms until we die. So these are very, very two fundamental difference, which is why, again, women tend to go through what they go through as in terms of hormones, because they have a specific amount of eggs. And that's when it's down to zero, this is it. But men, that's why you see men, getting married or even, impregnating a lady at 60, 70, 80 even, because they keep producing eggs. That's natural. That's nature. That's a fun fact. Huh? It's somehow funny, but that's how it is. Good. So the next point now, in adolescence. Now we're going to focus more on ladies, obviously, because that's the whole point of the talk. What we call menarche, that word here that might not be as popular as we might think. It just means the beginning of menstruation. That's it. The start of menses. Now, it differs from girls. It can start at 10, 11, 12, 15, 16 for some, but that's a bit late. Generally, it's around 10 to 15 to 14. And that it just means the beginning of menses. It's when you would find, the girl now transitioning from childhood to puberty now, or adolescence, or whatever we want to call it. Another transition comes with a lot of things, with a lot of things, include that, of course, the beginning of the menses, which is literally bleeding every month. That alone is a shock, which is the breast development, which is the body shape, alteration. You see now they're more curvy and all that. And that's the response of the body to the hormone. It's uncontrollable. So somehow, if you think about it, it can even be a shock. Because imagine as a man, things we can't even consider. Imagine from 12 now, you start bleeding every month, and you are told this will be your life until maybe when you are 50, 55 or 40. You see, those are the things we don't even consider as men because we just don't know. We don't know. We go through life like that. We keep playing. But ladies, at the very young age of 10, 11, that's the first shock they have. And it's nature. There's no help. That's how they just have to accept the fact that this is how it's going to be until, many, many, many decades later. So it comes also with an emotional toll. The whole hormonal changes now through the cycles. Every cycle comes up with its own almost mood swings, sensitivity and all that. Again, we do not know that as men. We just go through life like that, generally speaking. And again, it will depend on cultures. There are some cultures maybe where girls can be prepared, can be somehow bred by their mothers, or some where it's actually taboo. So she actually discovered that when she's bleeding like that. So imagine the confusion. See all that now, it plays a role into how the character is molded, because you can't really ignore that as a young lady, as a young girl at 10, 11. So you see, it becomes part of your life. Literally, it becomes part of your life. So yeah, it's really interesting when you think about it as someone who doesn't go through that. You actually cannot even understand it. So it's something to consider. So now life start becoming a bit more complex, a bit more, it starts to differ now. If a young girl was used to playing with boys and everything. Now things tend to change because some days she has to, be more to know how to prepare herself. Some days she just doesn't want to play, just like that. And it's okay, you know. But those things we might not even understand them as young boys. But they actually mold the character. So it's very interesting. Those are things to consider, you know. And eventually as they grow, as they get into their 20s, past adolescence, 20s, now the sexual life starts. Eventually, now they have gotten used to it because it is what it is. You have to live with it. Huh? But nonetheless, it has molded their lives, you know. A reality we do not know as men. We just don't, We just do not. So it's an interesting perspective. So again, as the menstrual cycle now keeps on, the hormone level rise and fall. And again, as I said, it comes with mood swings. It comes with periods of the menstrual cycle. When I say mood swings, it's like that's how it is. So all that contributes to how they experience life, how women experience life, which is completely, completely different. I would even say it pushes them. That reality pushes women to somehow be more mature earlier, very early in life than men. Because men, we keep playing. We think, I was born playing football or whatever I want to play. Nothing happened during my adolescence. Maybe, yeah, my voice got a bit rocky, and that's it. But there's no event that can shake us as the beginning of the menstrual cycle can shake women. Not at all. So we keep going through life like that. Monotonous, nothing really shocking, But for them, when they were 11, 12, that was a shock and they had to live around it. So when they're in their 20s and everything, 20s, early 20s, being a young lady, working, having a sexual life, getting married for some, all that, early, mid, or late 20s, it has become part of their lives, So something to consider. Again, you would find, if you don't consider that as a man, you might not even somehow understand how sometimes you are just interacting with a woman and you don't understand sometimes how what she says, how she behaves, and maybe you think, no, she's trying to to she was trying to undermine me or doesn't consider me. But perspective. If you consider what she's going through, which generally speaking we do not, you can get lost. So you can blame her, but it's a lack of understanding really, or even lack of knowledge maybe. Good. So the next now step, which is eventually for women who are now who plans to or who wants to have children, that also comes as a toll. It's another new change from the part of having every time your menstrual cycle from 10, 20, 10, 11 up to 15. Now you've gotten used to it. Now you want to have a kid, you get pregnant. That's a new shock, a completely new shock. There's new hormones that rises that put you in a state, again, that is even more shocking, which is the 9 months of pregnancy. Even beyond, even after you deliver, you even go through some other changes. So 9 months of pregnancy, it comes with a lot of nausea, a lot of vomiting, a lot of physical transformation. Like the lower limbs are swelling, the face is swelling, the nose is getting big, the mood swings, the fatigue, etc., etc. There are even extreme pregnancy symptoms that are not common, yes, but they are there. You find women bleeding, having gum bleeding, losing their hair, a lot of things, and that becomes part of their reality again for those 9 months. Things we do not know as men, and we will never know. So, and eventually to carry the pregnancy, the size as the pregnancy grows, the weight of the baby, the pressures from the lower abdomen, and all that. Now that's only carrying the pregnancy. Put now delivering the baby, which is another shock. That's the third shock. Huh? For maybe for boys or men, we've only gotten one in our adolescence and few changes, not no shocking event really. But for them, they are number three. the menstrual cycle, the pregnancy itself, now the delivery. And those are big, big, shocking events in a woman's life. Like, and that's nature, you know? So all these things, yeah, sometimes we should be, we should be understanding as men because they go through a lot. Now, delivering comes, they deliver eventually with a lot of complications that might happen. Most of the pregnancies or deliveries go through seamlessly, but there can be complications that can threaten her life, the life of the baby, and all that. After delivery, now comes the after delivery periods, which is another shock. Breastfeeding, the pain, the recovery process, like the emotional changes, the emotional toll, like of now nurturing a baby, especially the first 6 months. I remember when Emmanuel and his wife, yeah, were coming to for the follow-up after delivery. First of all, before delivery, the confusion, especially when it's a first baby, the fear and everything, the delivery, and then after the delivery, it comes the confusion. What are we supposed to do now? Am I supposed to breastfeed? What, am I supposed to have pain? How is this bleeding? When will it end? Like so many things, So, which is why sometimes when you see women who are married or who have partners and they're not really going along with them, coming with them, maybe in the clinics or even helping them go through these periods, I don't know. It's a disservice to women. It's really a disservice because they're also confused. They just don't have a choice. They have to go through it because it's the body. But again, as men, we should be really more understanding because it's confusing to them. They're not experts. They're also going through it as you're going through it as a man, but of course, deep inside compared to yours. So all that, I've put down there an interesting quote. I remember we were doing our study at the University of Nairobi, and one of our teachers used to say, women are not just men with vaginas. It sounds funny, but we might think, they're just human beings. It's okay. Just with different patterns, it's okay. But that's not true. There's a whole thing behind, there's a whole thing that is completely different from men. And the sooner you accept it as a partner, as a male partner, and you are with your wife or your partner, you don't have to get married, the more understanding you become, and the easier it is, because you can understand some things you might not have understood if you don't really take time or at least try to understand what they go through. So it's more of insights. These are insights I'm just sharing so that we consider it and it can be the basis of our discussion. So next point is again something I wanted to mention about menses. Now, we might say menses having the menstrual cycle, having periods every month, and we think it's that. It's not that. It comes with a lot of things. There's a lot of disorders that can happen. The bleeding might be more heavy than normal. Sometimes it gets heavier, which are cases we see almost every day. Yeah, it can be heavier to the point where the lady in question bleeds a lot to the point where she is actually anemic. Her blood levels goes too down to the point where we have to transfuse because of one reason or another. There are many causes. I'm not going to go through the details, but having a menstrual cycle, which is my point, comes with a lot of potential complications, specifically for menses. That alone, things we cannot even begin to understand as men. Severe cramps, a lot of pain, heavy bleeding, abnormal cycle, especially after pregnancy. Add now the family planning, methods we currently have. They are mainly targeting women, and all those have impacts on their bodies. So you see, how many now? We are almost at number 5, shocking events, 4 or 5, and men, and we're just here. We might have other pressures, social pressures, but these actually, we have to understand this. Not deeply, but at least you have to have an idea of what they go through so that as their partners, as their friends, or whatever we want to call ourselves, we get more understanding. Good. And then now, menopause, number 6 now. Can you imagine? menopause now, which is a completely now, this is not even as popular as all the other stages I mentioned, because again, because we just consider, at this point, women are old, they're experienced, they're wise, it's okay. But that's not true. That is not true. It comes with its own set of symptoms and severe symptoms sometimes. Okay, maybe not life-threatening, but still severe. Severe. I see a lot of women in their 50s, late 40s, let me say 50s. Most commonly it's 50s. And when she comes, she just say, "Sasa, I am sweating a lot. And I'm not, I mean, the weather is not bad. I'm not stressed. There's nothing really stressing me, but I'm sweating. I'm having hot flashes. I'm having a discharge. I can't even know what it is. I've spent this amount of months without periods, or it comes and goes, like complete confusion, and those can be signs of menopause. And that's really, it's really bothersome, especially when you work. At this stage now in your career as a woman, you have grown, you are far, maybe you are, at a bit higher in the senior management, you're having meetings and everything, and now you start having symptoms you can't even control, and you don't even know what to do, you know? So that's why you'll find, especially in Kenya, or generally speaking, the world, that even in our field, the medical field, people are starting to get interested in menopause and its symptoms. But somehow it has not been mastered compared to other conditions I've mentioned before. The menstrual cycle, the normal reproductive years, and its disorders, the pregnancy, childbirth. Now it's starting to come up so that we can understand well how many are the symptoms, how bothering are they, how can we address them? Do we even have medications for that? How can we advise even advise? You see all those things, they have been happening. So you see now, so you understand what they go through. Our mothers, I guess at this point it's our mothers, or even our grandmothers. So you'll find menopause is actually not even a day, or you say now the menstrual cycle has stopped. It's okay now. I'm in menopause. No, it's more like it's more of a transition. Go from reproductive years to menopause. And this transition can take years, 10 years, 5 years, 4 years. It depends on women, but it can take many months or many years even. So you see, those are things we actually have to consider, Yeah. I was reading yesterday, I think, how in the West, they're trying to find, they're actually starting to find some correlation between menopause and the rate of divorce in ladies that are in their 50s and 60s. Because they go through these things, they don't know what it is. They feel like they are not loved enough by their partner. They feel like they are not even worthy of love because she feels like she is dirty. She's sweating a lot. She's having hot flashes. No one can love her. And then eventually she says, you know what? My partner is not, my husband is not even understanding me. Let me just, when it lasts for 1, 2, 3, 4, 5 years, I'm like, let me just leave him. He's not trying to even understand him. It's menopause. She might not realize that herself, even the partner, and even the system generally, the medical system, we might not even be there enough to advise or to say, okay, this is what you're going through. It's a period and it's okay. It will eventually finish. So all that, socially speaking, it has an impact. It has an impact and we cannot ignore it. We ignore it, then it's like, now what are we even doing on earth? We're not even helping women, There's no point now. I mean, we're not really having an impact on what they're going through, and it's not good. Okay. Now, one of the last slides is about, I was actually mentioning it throughout the slide, about the emotional and psychological impact. From beginning, the menarche I mentioned, the beginning of menstruation up to menopause, every stage, which is around 6 or 7, they have their own impacts, emotional impact and psychological impact. And when now a woman is not in an environment where at least she's understood, at the very minimum she's understood. You see now, that's why you'll find the rates, generally speaking, in countries where they do a lot of research, you will find the women have the high rate of depression. You can't even compare to men. Men have, of course, you know, a high rate of suicide and what they go through, but the deep depression for women is quite high, quite high. And this has a lot of part in it. The fact that if she's in an environment where she's not understood, eventually it will come out. We are all human beings. Eventually it will come out as depression, as fear, as you know, as bad mood, as etc. etc. Because there's no environment to at least understand her. Okay.
Nothing now. This is knockout football.
So this is something to consider. Again, as I say, this is to bring up the discussion. It's not absolute. I might not have mentioned some things, but that's the whole point. This is insight and basis on an eventual discussion we can have. Good. And then the last point now as a conclusion, something to think about as men and women, obviously, especially those who are in relationship, because again, you are with someone who is supposed to understand you. And they can't understand you unless they know these basic things. And it's very basic, really. You don't have to be too technical to understand this. So again, just to go over the conclusion, the hormonal changes across women's life have a profound implication in the overall health, be it physical, emotional, social, psychological. And understanding these changes, especially for men, it helps. As for men who are living with these women, it's good. It's good to understand. It's good to, you know, to even create a door for them to let it out sometimes if they want to, because you understand. But if you don't understand, you just say, no, she's just pretending. Is she really? So these are really insights. And even though we might not really grasp the reality, again, it's not us as men, but at least some basics and try to understand her, generally speaking, try to understand her. Try to be the rock, as people say, I usually like to say. So this it marks the end of my presentation. And I think I gave a really foundation of what I wanted to talk about, which is how completely different and fundamentally different we are with women, and how we should actually use those differences to understand each other, especially us to understand them. And eventually, you know, try to live better with them, to understand them, to have a bit more empathy, so that our lives eventually can be better. You know, we keep living together. We can't go anywhere either way. You know, we are made to live together. So thank you, everyone. And I think this is the end of my talk.
Thank you, Daktari. And indeed, there is strength in our differences. I think that was a wonderful, wonderful presentation. I know you are in a rush, but if you can give us
Yeah.
5 to 10 minutes for questions.
Mm.
At this juncture, we'll take a few questions. I had gotten some 3 questions earlier. Maybe you can take these and then a few more questions on chat. If you feel your question is very private, in the chat meeting, you can add a Daktari alone, and I think he will be able to view alone. And if it's a general question, you can send to all of us in the chat, or you can raise your hand. First, given your talk, there was a question of, there is a talk about most women are being told that they need to get pregnant so that they are able to get healed of endometriosis. That's the first question. The second question, importance of uh, fathers, or being there during the pregnancy, delivery. It's a In the African context, many fathers fear the delivery room or theaters. So maybe you can say something about that, not in reference to anybody. And then, of course, why there is a rise of CS, like in the corporate life, in my office, all the people I know who have given birth in the last 2 years have all gone through CS. What could be the factor? Is it the money? Is it so? Those 3 questions.
Yeah, I can start answering those. So the first question about endometriosis, that's such a very good point, which is actually among the the menstrual disorders I had mentioned, like complication that comes with just having a menstrual cycle. Endometriosis is one of them. And it's actually a pretty serious disease, really. It can really be, it can really be complex, very complex, and it's very extremely. We usually describe the pain that women have during when they have endometriosis, like it's excruciating pain, like it's pain you can't even control. Women faint, women vomit during their period. It's a specific pain that comes when you are having periods. So it can get a bit more complex, but let me not again be too technical. So pregnancy does not relieve of endometriosis. It can relieve of that during the 9 months, but once you go back to having your periods, again, it comes back. It comes back. It's a mechanical issue. It's a mechanical problem. It's when, okay, let me, again, not try to be too technical, but let me just describe what it is. It's when, you see when a woman is having periods or menstrual cycle, it's the inner lining of the uterus that is shedding off when there was no pregnancy. Now, that inner lining of the uterus is called endometrium. The name is endometrium. When now those cells, for one reason or another, which there are many causes, they come out of the inside of the uterus and then eventually go into the abdomen, into the tubes, the bowels, sometimes the ovaries. When you're having your periods, because the periods come out as a response to the hormonal change, those cells that are also inside your abdomen, they also bleed, which means you are bleeding inside internally. So, which explains the excruciating pain, which, you know, all the symptoms that come with it. So no, the response is no. It does not alleviate endometriosis. It might alleviate it during the 9 months, but once you are back to your period, back to the pain. So it requires more tests and more other management, which is not pregnancy, definitely not. So good. Second point, which was the CS rate in the corporate world. Now that's more of a social, I would say it's more of a social causes, because some women they come and tell you, I don't want to go through that pain. You know, and you can't push her. You can't say, no, you have to go through it. I mean, you know. So actually, if you go through the WHO cesarean section indication, you would find maternal request in there. So the mother can just come and say, you know, I don't want to go through this. I want to go straight for CS. Let's plan, pick a date when labor is not there yet. So it's, although there are not many, I have to say it, and so far in my there are not many, but there are some cases. Of course, now there are other indications. And you'd find most of the indications comes also with lifestyle. So by lifestyle, I mean, you see the way we eat now, generally speaking, even in Kenya, it's more of a Western diet. So you'd find we are more we are, I wouldn't say bigger, but we are more on the heavier side. Yeah, especially women or even men. So obesity is one of the causes of a lot of cesarean section medication. So you would have a big baby if you are obese, which would, again, that's another indication. If you have a baby that is more than 4 kg, we usually don't try labor on that because it's too big and it's too risky for you. So there is, yes, the fact that some of them want to try, but also lifestyle. Lifestyle causes are also there. And we can't just, you know, say no to that, because what we want is a healthy mother and a healthy baby, which is something you can't negotiate. So whatever vaginal delivery or CS, as long as we have a baby is okay, mother is okay. That's the whole point. That's it. There's a question I forgot. Number 2, you can remind me.
Importance of fathers, you know, being there.
Yes. Oh, yes. So I think I had mentioned it during the presentation, how personally, actually, I see not coming in the labor room. I don't understand. Okay, maybe, which I agree, can be a normal cause. Some people can't, you know, they can't see blood. You know, they usually faint when they see blood. Maybe on that case, I can understand, because it can be graphic sometimes. But at least once you can come in the labor room, which most of the modern labor rooms now have, and you stay on the mother side, which means you don't come on the side of the vagina and everything. You let us do it as professionals, but you stay with the mother, you talk to her, you hold your hand, you hold her hand, all that, without coming and see what's going on, you know. Be there. It's always good. My point is, you have chosen that woman to be the mother of your child and eventually to live with her your whole life. And then you let her go through such an experience alone. What's the point? You know, it's not even logical to think about it. Such a big event in your life, both your lives, you just let her go through that alone. I mean, what's the goal here? So that's my point actually. Now, maybe it can be debatable, I don't know, but what's the point if you can let her go through that alone and you are here? Where would you be really? You know? Good, that's the point.
Yeah, let us know how many more minutes you have. There are a few questions in the chat. I know you can check the chat. Some may have been directed to you, at you only. There is one in the chat. Is there any pain that women go through in post-pregnancy time, like 1 to 2 months?
Yes. That's a good question. Actually, we tend to say that all the potential complications from a pregnancy, as long as you are still in the interval of 6 weeks after the day of delivery, you are still at risk of having all the complications. That includes bleeding, that includes abnormal pain, especially that includes infection of the wound, be it CS or the wound of maybe if you had a tear or anything. So, which is why we follow you up every 2 weeks until you reach 6 weeks post-delivery. Emmanuel knows that because we went through it. So the first 2 weeks you come to see how the wound is healing, if it was CS or if it was any other issue. After 4 weeks, you also come, and then after 6 weeks, that becomes the last follow-up. 6 weeks, that's a month and a half. Usually by 6 weeks, you're almost back to normal. Really, those on and off pain or on and off bleeding, they're almost over. You're almost back to normal. You can walk normally. You can go through life, normally, unless there was a huge complication. But by 6 weeks, generally, you are back to normal. So yes, absolutely. Pain, yes. But there are medications for that to help you go through that period. Yeah. So yeah. There's a question for you, Emmanuel.
Ignore him for now. Are there any questions directed to you?
Yeah, there are. So there was one question said, could hormonal imbalance be a cause of painful period cramps? And how can you manage imbalance? Yes, actually, a direct cause, maybe not a direct cause, but endometriosis is actually one of the hormonal issue that can cause painful period cramps. There are medications nowadays, let me tell you, there are many medications to help you regulate your menstrual cycle. But of course, we have to rule out any underlying issue. If all the underlying tests, to test any underlying potential issue are normal, now we go to make your cycle regular. About the pain, extreme pain when having periods is not normal. Never normalize it, really. Let me actually even stay on that for a while. As you know, I'm seeing most of the questions directed at me are from women. And actually, let me tell you, do not normalize a painful period. Just do not. Even when people tell you you are pretending, all the women go through that. Why are you special? That is not true. If you feel like it's painful, go and consult. You're not supposed to go through that. Let me tell you a story. Last week, there is a lady who came, a teenager really, 16-year-old, who came with her father. And that was a good father, really. I really appreciated it. The father came with her because she was in extreme pain. And it started when she was 12, when she was having her first period. It has been painful almost every month, to the point where she faints. Imagine fainting. So when they were coming, They came, of course, we gave pain medication for the current pain. It worked, but eventually I said, Sasa, we have to investigate because this is not normal. So, because again, you cannot normalize that kind of pain. I mean, you have a life to live. That's not serious. So eventually we did all those tests and we realized yes, endometriosis. Now imagine if she could have just stayed at home, or the parent just say, you're not alone, even your mother went through that. You will eventually get used to it. And she's fainting every month. So just don't accept whatever people are telling you, especially older women. They just say, women nowadays, they are pretending they are not strong enough. That is not true. Just come. We see how it is. If we don't get anything, there are medications now to help you. If we see a potential cause, good. Now we address it. But don't just go through that alone and suffer. So the next question, say for irregular menses, they say this changes upon birthing, about giving birth. Is it true or false? Also, how hard or easy is it for a woman to get pregnant? If hard, is there medication to assist with this? And does age affect the ability to get pregnant? Ooh, that's a good question. Now, irregular menses is irregular menses. Whether you conceive and give birth and then it will come back as irregular menses. Generally speaking, of course, there are exceptions. But the point here is there are many causes of irregular menses, irregular periods. We have to investigate the causes once you come. So it's not a one size fits all. It's a case by case. So, and no, just giving birth does not automatically or magically make your periods regular. Not really. It depends on the cause again. So consult, depending on your story, there are investigations that are done, and then eventually we see what can be the cause. And yes, age plays a big, big role in conceiving. Why? Because going back to what I said, let me repeat it. The amount of eggs women will ever need in their life, they are born with them. There will be no new eggs produced. So when you are getting closer to your menopause, to menopause, it means the ovarian reserve, that amount of eggs is getting depleted. Every month when you ovulate, you release one egg. Generally 15 to 20 eggs were being recruited, but only one was released. So every month, imagine you release 15 to 20 eggs, but one is eventually ovulated and then it comes out as a potential, a potential baby. So from 11 to 12 to around late 30s, mid 30s, early 40s, you've been releasing 15 to 20 eggs per month. You see now there are many, they're in the hundreds and thousands. Generally, the average is around 400,000, 300,000. 200, depending. So what we say is usually that when you are 35 years old, that's a general principle now. There will always be exceptions. We always deliver for ladies with 42, 47 even, Rarely 50-something, but in the 40s, we deliver a lot of mothers and they conceive naturally. But the point here is, the more you wait and you get closer to your menopause, the more risky that pregnancy is. Not only because your body is aging, which is natural, but also the eggs, the best quality of eggs were released early in your reproductive years, in your early 20s, mid 20s, late 20s, early 30s. Once you come closer to your late 30s, now, that's why you would see middle-aged women, they tend to have a lot of miscarriages. They tend to have a lot of complications during pregnancy. Why? Because the quality of the eggs have decreased. So, which is why, again, we tend to advise, if you're planning to conceive as a lady, plan it. Finish with that story in your maybe early 30s or late 20s, and then keep living your life. Of course, if you conceive in your 40s, no worries. We will follow up that pregnancy and we plan to make it better, you get your baby. But as far as planning, make it a bit early in your life. It's easier, you are still young, your body can recover faster and less complication. These are general principles. You will always find women who conceived in their 40s. There are many, we follow up many. But general principle is different from exceptions. Good. So I think the other question was, does the quality of sperm also decrease with the age in men? Very good question. It does. especially I would mention this with men. Lifestyle has a lot of, even in women, but let me answer this question for men. By lifestyle, I mean obesity again, alcohol abuse or excess, tobacco, like substance abuse, generally speaking. It has a lot of it has a major role in the quality of sperm and even in the quality of the pregnancy. Let me tell you, there are new researchers that are revealing, again, it's a new subject somehow, but it's revealing that the quality of the sperm of men can actually plays a role in miscarriages, especially early trimester miscarriages before 12 weeks. So you see, it's not all about women, which is why these things count. We have to understand each other. There is no other way. If you want to live together, if you want to live together, there is no just other way. We have to understand each other. You know, the sooner we understand this principle, the better, the better. So yes, it does, absolutely.
Thanks. I have another question here. Someone has sent hormonal versus non-hormonal FP, which as a professional, what do you recommend? You're on mute. You've been speaking.
Yeah. Sorry. I was saying definitely I recommend non-hormonal. Non-hormonal because again it doesn't affect your cycle. Okay, it doesn't dysregulate your hormonal cycle, which also comes with a lot of changes. Let me tell you, you can't imagine what the symptoms of menstrual cycle. There's a lot of mood swings, a lot of sweating, sometimes heavy bleeding in hormonal family planning. You know, there are many methods. There's the implant, the injection, the pills, a lot of bleeding, heavy bleeding, pain. So personally, for a lady who is planning to have kids, but who has not conceived yet, I generally tend to advise them to start with an hormonal. You know, don't start dysregulating your cycle and you haven't even conceived yet. But you'd find women who tried hormonal and it actually works for them. And when they actually come to talk to you, they say, no, I want this method. That's clear. If it works for you, good for you. Besides, it's even better. But generally speaking, a lady who wants to start family planning, I usually advise non-hormonal, which is the coil. The coil, it's commonly called the coil. The IUD, there are many names, copper T, whatever. But non-hormonal has less side effects. Yeah.
Please also mention that condoms are non-hormonal. I think
Yeah.
you're on
Include
mute.
condoms, include pull and pray. There are so many things now. But the point is to avoid hormonal. But if you have found that one works for you, good. Yeah, no one will tell you stop it. If it works, it works.
Okay. Do you have any further questions on your end? I think on my end and on the chat, I can't see anymore. Or any hands up? Because we are running late. It seems all has been covered.
I
Are you
think
getting any questions?
there's no question. That's it.
Okay. Thank you very much, Dorel and Ndayisaba Umosh. How do you say the other name?
Ndayisaba.
Ndayisaba. Yeah. Thanks for making time to be with us this evening. It's been an insightful. It's been. I think we need to the gentlemen. Let's be kinder. Let's be more understanding. And I think, as you've said, you've insisted that women are not men. Women are what was it? Women are not men.
Women are not men with vaginas.
Yes.
Eh.
Okay. And actually, to your point on menopause, this month I think it's an women something month. So there's been so many menopause talks in the office. So I think, as you mentioned, there is many research and all that. So I think that was also insightful. So thank you very much. Now that we have no much questions, we will just. How many minutes can you still give us, Doctor?
Sorry?
How many more minutes can you still give us? We just need to go to our next page where we close out the meeting and all that.
No, it's okay. It's okay.
Okay. So so we'll just since there are no more questions, so we'll just go to our our announcement, and then we close the session. So, as part of our celebration of the World Water Day, we are partnering with Beyond Water, and Rotary Jabali donated 2 water filters and 1 hand washing machine. The project will be launched on the 7th in Narok. Mary will be representing us on this, and then we have the big day coming up, Sunshine Rally, on the 15th of March, where we interact with kids who are able differently. It will be in Jamhuri Showgrounds. We've done this before, so I'll ask all members and friends of Jabali to show up on the Sunshine Rally. And then just an update. We noticed that this year, if you noted that this year our body groups we split it down in the spirits, which Daktari has mentioned. There is the Jabali ladies. They'll be meeting in Mili's house on 12th of April. So it's I think it's open to Jabali and friends of Jabali. So that's where you go and discuss everything and bond more. And the Jabali men, we have a men's conference coming up on the 12th of April, where we can discuss, I think, being the things which we've attended and mentioned today. So just to note that ECC chamas are these are just body groups. These are not CWS or CMS or women's guilds. We just meet just because we meet online. We try and make physical touch and contact. So that's why we are meeting on this. And of course, now to our SAS session. What we gonna learn, how we gonna say thank you. Doctor, this is just a moment when people comment on how the talk was. You will hear compliments, sometimes complaints. So the floor is open. I'm just rushing this because of time. The floor is open. Happy dollars, happy sads. And I'll also be finding some people. Samuel Karanja said he's a member of CWA, so I'll find you a dollar on for that. A dollar in Rotary is 100 shillings. This is in support of our programs and projects. So the floor is open. We can do it in the next 5 minutes. Any happies or sads? Please unmute your mic if you can. Drop in. Mutie?
Thank you, President. I would like to give 10 uppies, especially for Daktari for the good fellowship tonight, and also highlighting your use case or case study. I hope you can be able to share more during our men's conference. Thank you.
Thank you, Mutie. So, Daktari, it seems you have more invites. We'll just look at your schedule. You mentioned that you have a history with Rotary. So, in case they reach out, whether the Jabali ladies or Jabali men, you can slot them in something. They wouldn't. They are nice people.
No worries.
Okay, Eric.
Good evening, everyone. Now, I have $2 happy for the learning and to thank our guest. Also, my wife has chipped in $2 happy. She says she has learned a lot and is encouraging that Daktari continue preaching the gospel.
Thank you.
Thanks.
Daktari umeambiwa endelea kuinject.
Kabisa.
Yes. Hey, please let's speak. Let's drop in chats. Because
The President, I have $5 happy. 3 from me, 2 from my husband. He's also learned a lot. I appreciate today's conversation. And Daktari, good work. Keep preaching the gospel. Even in this men's conference, I hope the case study will be discussed inextensively, but also just creating a space where also men learn from a professional and in a safe space. So thank you. And yeah, $5 happy.
thank you, Sandra. Dr. Elvis Karanja, I think in the spirit of hosting your senior in the profession, maybe you can say something. Elvis Karanja. As Elvis removes his gloves to speak, we have $2 happy in the chat from Ephraim Fred Mwamba. He says he appreciates today's conversation. We also have $3 happy from Kennedy. He says the talk was quite insightful. And I don't see Jabali's hand is up. I guess that's Mutie. I'll also maybe ask. Hi.
Do you see in town?
Hi, Jacinta.